Welcome back, advocates. Today is our final day of summit programming, and we have some exciting things in store for you. We've talked about our request for $120 million for the Prostate Cancer Research Program, and today we'll hear from the staff there about the newest updates on their work. We'll also hear from patients who have served as consumer reviewers, helping to award grants under the Pcrp. They're a fantastic example of how you can get involved and help to drive research towards new and exciting treatments. We've mostly focused on federal policy this week, and next week you'll be heading to Capitol Hill virtually to advocate for change at the federal level. But there are many ways you can make change at home. State and local policies have a tremendous impact on the lives of patients and their loved ones. Today, we'll talk about Zero's primary state legislative initiative, zero cost to prostate cancer screening, and other opportunities to impact policy at the state level. When you're thinking about how you can get involved with Zero's policy efforts at the state or local level, or thinking about other opportunities you might have to work with the rest of the Zero community, I hope you think first about our chapter directors. They're a tremendous resource for support and action in your own backyards. And they're joining me this morning to welcome you to your final day at the summit. I'll let them introduce themselves.
I'm Emily Sybrandt. I'm the Midwest Chapter Director serving Minnesota, Iowa, Wisconsin, Illinois, Nebraska, Kansas, and Missouri.
And I'm Renee Haney, the East Coast Metro Area Chapter Director. I cover New York, New Jersey, and Philadelphia.
Hi, everyone. I'm Caitlin Koziel, formerly Murphy, and I'm the Mid-Atlantic Chapter Director serving Pennsylvania, Delaware, Maryland, Washington, D.C., Virginia, and North Carolina.
Hi, everyone. I'm Tracy Kreitz, and I am the Texas and Oklahoma Chapter Director.
Hi, everyone. I'm Demetrius Key. I'm the Southern California Chapter Director, and I cover from Bakersfield down to the Mexico border.
Good morning. I will speak up for Rhonda Gilmore, our Northern California Chapter Director, who could not be with us today, and she covers the other part of California, north of Bakersfield, all the way up to the Oregon border. And my name is Vanessa Peterson. I support our wonderful chapter team across the country, and myself, as well as all of our wonderful chapter directors, are here to connect with patients, families, the medical community, and everybody on the local level to help fuel Zero's work and amplify the patient's voice. We're your connections for everything Zero has to offer as we work together, reducing the pain and suffering of patients and ultimately ending prostate cancer. Back to you, Allie.
Thanks, chapter team. If you want to connect with your local chapter director and learn about how to get more involved with Zero's policy work or everything else, visit the Zero booth in the virtual health fair on your app. You'll find all their contact info there. And with that, let's get going on today's program. Thanks for joining us today.
Thank you.
Thank you.
Thank you.
I first got involved with Zero back in 2017. That's when my father was diagnosed with prostate cancer, and I didn't know a lot about it. And so I immediately started researching and came across Zero. Then a few months later, I decided to attend a run walk down in San Diego, and there was information about the summit. And, I went to college in DC, and, it seemed pretty interesting to be able to actually talk to Congress about different things in the prostate cancer community. So I decided to go. It worked out that my particular House representative was the head of the Appropriations Committee at the time. So when I got to DC and, looked at what we were doing, it really struck me as something that is important. Not only important, but essential, just because of the funding for the Prostate Cancer Research Program, how many different drugs that it actually ended up creating and different procedures. And so when we went to Capitol Hill, it was amazing. So at first, I didn't want to talk as much because my dad's prostate cancer journey was shorter than a lot of the other advocates. And, some of the advocates had lost their father or brother or dad, just other family members. And so I just kind of briefly told my story. But when it came down to the ask, I was able to convey exactly what we needed. And so after that, I felt I had no choice but to get involved as an advocate for Zero. because I have the tools. I come from a large family with over 40 cousins. I've been in the military. I played football until I was 30. So I'm not easily intimidated. So I have no problem presenting the data as well as making the ask. And it's very important because when you reach out to them and you talk to them, like, they work for us. And it's important for them to know what their constituents are going through. And I feel that I can convey that with ease. And I have a tenacity that's pretty heavy that allowed me to get the meetings that I needed. So not just for the summit, even in my community typically during August recess, I'll get meetings with both of my senator's office as well as my House member's office. And so, like I said, I feel that not only is it important, but it's somewhat of a calling to me. So much so that now I'm actually the Southern California chapter director for Zero. So advocacy is that important to me that I think that I wanted to go beyond my community and help the prostate community on a national level. I would say to someone who's not as comfortable making the ask is just be you. Tell your story, because that's what they like to hear. That's what's compelling. So express why prostate cancer is important to you. Express why the research matters. Because they have to listen to you, and they're going to be compelled to listen to you because of your story, and they want to help the people that they actually represent. So you don't have to know all the stats and know all the numbers. A lot of times there's leave behind information. So you don't have to memorize any of that. Just, if you get the meeting with them, then be you, be yourself, be comfortable. Most of the time, they're really easy to talk to and to interact with. So you don't have anything to be nervous about. So when you go back home, there's several things you can do. So not just on Capitol Hill. So one of the things that I've done over the years is proclamations. And with proclamations, specifically we do it for Prostate Cancer Awareness Month. So it's an opportunity for a city, a county, state to recognize September as Prostate Cancer Awareness Month. Now, some cities actually have a form on their website. So you may not even have to specifically talk to anyone in person because Zero actually gives you the language of the proclamation that gives the stats in regards to the rate of prostate cancer, and is actually also specific by state. And in some situations, they'll just mail you the proclamation, but in other situations, they will invite you to like a city council meeting and present you the proclamation. And so it gives it a chance to not only get the record on the books for it to be recognized, but it allows you to be able to interact with local government a little more and remind them like, hey, we signed this proclamation, and so I'd like to get you at a health fair. I'd like you to sign on to this bill. So it gives you a little bit more leverage. And I've even gotten my congressman, whose office is maybe 15 minutes away. I got him to not necessarily do a proclamation, but we use the wording of the proclamation to do like a certificate of recognition in Congress. So with the proclamations, you can have a broader reach. And most of the time you can do not just your specific city, but your surrounding area. And you can use that for each city. I think a few years ago, I was trying to get one of the bigger cities around me, and I leveraged the fact that every city around them had signed on to the proclamation. And so that was, I think, the push to finally get them to sign on to the proclamation as well. So don't think that, you have to just do it on a national level, because local helps as well.
Dr. Melissa Cunningham is the program manager for the Prostate Cancer Research Program. She's responsible for setting the vision of the Pcrp, developing funding opportunities, and overseeing the whole process. The Pcrp is one of our top legislative priorities this year, and we'll be asking for $120 million. Don't forget that number. Join me in welcoming Dr. Cunningham.
Thank you so much. It is my pleasure to be able to address this virtual audience today and tell you a little bit about the Prostate Cancer Research Program that is part of the Congressionally Directed Medical Research Programs. Again, my name is Melissa Cunningham. I do manage the Prostate Cancer Research Program, and I want to start off today by, first of all, explaining who the Prostate Cancer Research Program is for those of you that might be unfamiliar with us, and then go into some more detail about what makes us unique as a funding organization and what types of research that we are currently looking to support with the funds that we have available, and some of the outcomes that we've been able to generate in the past year or so with the research that we've supported to date. So again, first of all, who is Cdmrp, which is our parent organization? Again, for those of you that have not heard about the Pcrp before, we are part of the Department of Defense, specifically within the Department of Army's Army Medical Research and Development Command. This organization has a long-standing history of supporting research and efforts that will support the warfighter and other beneficiaries of the military health system. Because the general public is not the only individuals that get prostate cancer, both active duty service members, veterans, as many of you in that part of the zero community are aware of, as well as beneficiaries, again, of those active duty service members and veterans are all susceptible to getting prostate cancer. And therefore, our program and the research that we conduct is very relevant to the mission of the DoD. Next slide. So one of the things that helps understand who the Pcrp is and how we go about finding the research that we ultimately support with the funds we have available, it helps to understand the history of our organization and, again, how Cdmrp came to be. That started back in 1992 due to a grassroots advocacy effort by the breast cancer community that heightened political awareness around issues surrounding breast cancer and research that was needed to address that. As a result of the voice of that grassroots advocacy effort, Congress then decided to appropriate $210 million to create the first Cdmrp program, the Breast Cancer Research Program. The United States Medical Research and Development Command, again, was tasked with managing the breast cancer research program. And because this was something that was very different to the other research efforts that the MRDC had managed and directed in the past, the Army went then and sought the advice of the National Academy of Medicine, previously called the Institute of Medicine. And that advice resulted in two hallmarks that are still important to all Cdmrp programs today: a two-tier review process, which I'll talk about more in a subsequent slide, and a new research model whereby the consumers that were integral to the creation of this program were incorporated into all aspects of our research process, including the program policy, investment strategy, and helping us define our research focus. And because of our initial efforts and subsequent efforts, and success with those initial programs, additional research programs have been added by Congress for Cdmrp to manage. On the next slide, you can see that currently, as of FY20, Cdmrp currently manages 34 different research programs, which are listed here along with their FY20 appropriations. We are still currently well within the FY20 cycle, most of these programs still identifying and funding research with those FY20 dollars, even though we did just recently learn about the FY21 appropriations. But as of FY20, those 34 different research programs managed by Cdmrp and investing this year alone $1.2 billion into research supporting these different areas. Next slide. So as you can probably notice from that list, we are not the only organization that supports research to address those various diseases and conditions. And therefore, again, it's important to remember what makes Cdmrp and how we go about addressing research for those areas, what makes us different than other funding agencies. So here you can see a list of, again, some of the hallmarks that in many cases are the result of, again, that history lesson about how Cdmrp came to be through that first breast cancer research program. Again, it's important to realize that each of those programs have their own dedicated appropriation, and those research funds are added to the DoD budget by Congress for the specific purposes of, again, that particular program, that disease or injury related condition. So again, this is important to remember because we are not part of the presidential core budget. Therefore, no funds are being taken away from the warfighter or our defense, but these funds are added to the Department of Defense budget by Congress each year. We really are dedicated to supporting high impact, very innovation driven research ideas. Again, that goes back to the voice of those initial breast cancer advocates who said, we know research is being supported in these areas, but we want more innovative ideas that are going to help us hopefully get to a cure faster. So that's something that all of our programs are still very much focused and dedicated on supporting through the types of funds that we have available. We, of course, make sure that we're not duplicating efforts with other funding agencies. We work very closely with other federal and non-federal partners to make sure that we're hopefully addressing underfunded or unmet gaps and not doing the same type of work that they're doing. Again, we also have that two-tier review process and the integration of consumers throughout our process, which is extremely important to all of our programs. Lastly, we don't have a pay line, which gives us flexibility to support the research that we feel will best address the needs of the program and the goals that we have set out for us. Next slide. Again, there's unique partnerships that are very integral to making the DoD's programs a success. The consumers are the reason that our programs exist, and they demonstrate the need from the patient perspective. Again, speaking for their representative communities, bringing passion and perspective about the reason what our programs exist and who we are ultimately trying to help, which again is our patients. That, of course, also involves their voices coming to Congress and telling Congress about why these programs are important for the DoD and to help support, again, research in those areas. And as a result, Congress adds funds to the budget and provides targeted guidance to our programs to help provide those needed funds to support that research. We also are integrated with the researchers who are bringing those innovative ideas forward to help address the gaps that the program has set out, and of course, ultimately producing the products that are going to go back and help benefit the consumers and the patient communities. And of course, the DoD partners who help oversee the program management, the contracting actions, and regulatory requirements that ultimately help bring all of these different partners together to help us improve outcomes for prostate cancer patients. So we mentioned the role of consumers in the Pcrp and Cdmrp programs numerous times by now. Again, they are extremely important for our processes, and we very much value the role that they play in all the different aspects of our program cycle. We're proud of the fact that to date, over 2,600 consumers representing over 1,200 different organizations have served on Cdmrp peer and programmatic review panels to date. We are always looking for new voices to add to our review processes. And so hopefully what I've said so far has sparked interest in those of you that perhaps have not had the benefit of serving as a Pcrp consumer reviewer before. So I encourage you to stay tuned for additional information about the Cdmrp booth that will be available for you to find out additional information. And of course, you can always visit our website to learn more about the roles of consumers and how you can become involved as a consumer representative. So here I just wanted to briefly go over again how our process works and what that two-tier review model is that is incorporated into our reviews and therefore makes our funding organization a little bit different from other agencies. Everything starts off with receiving congressional appropriations at the beginning of the year. Again, that's not a guarantee in the budget, but once Congress decides to add those funds, that helps to start this cycle of deciding how we want to invest those funds and identify the research that we'll use to support. Vision setting is the first step after the appropriations, where we convene a programmatic panel, which is a panel of representatives from the scientific, clinical, and consumer community who come together and help the program decide how we're going to try to invest those funds to make the biggest difference for prostate cancer patients. Ultimately, that helps us determine what types of funding opportunities that we want to release for the year. And then investigators submit applications to those funding opportunities, which are then reviewed at, again, two different levels. A peer review level, where scientific experts and consumers come together to provide scientific evaluations of those proposals. And then those proposals, the ones that are of highest scientific merit, then come back to the programmatic panel at our second level of review, which we call the programmatic review level. There, the individuals who helped establish the goals for the program at the beginning of the year at our vision setting meeting look at the strongest peer-reviewed applications and ultimately decide which ones they would like to recommend the program support with the funds we have available that help best address the goals and the needs of the patients that we set out at the beginning of the year at our vision setting meeting. If you go ahead and click again, you're going to see some stars pop up. The red stars on the slide hopefully. They indicate where throughout, again, our program processes the consumers are involved. Again, you can see that the consumers are involved at 4 key stages: at vision setting, by screening applications if we do a pre-application screen, as well as the peer and programmatic review processes. So again, the role of consumers and patient advocates in our processes is very important for us. Next slide, please. Again, at vision setting, this is an important part of our processes because each year the programmatic panel comes together to recommend an investment strategy for the program with the funds that we have available. We consider a lot of different important factors when setting those goals each year, including whatever Congress has suggested in the language that they provided with the appropriations, current research landscape, what gaps there are, what emerging technologies might exist that might help the program shift into a different direction. Again, also considering research gaps and gaps for other funding organizations, and ultimately what we feel will have the greatest impact for the patients that we're trying to support and serve. To date, the Prostate Cancer Research Program since FY97 has been fortunate to receive $1.93 billion in appropriations, which we've been able to use to support over to review 18,000 proposals and support over 3,300 awards to date. And that's not including the awards that we're still reviewing and recommending for funding right now. So this is only up through FY20, and we were very excited to have our highest appropriation level in history in FY20, which again was $110 million. And of course, also received the exciting news that in FY21, we will again be able to have $110 million of appropriations to fund new research in the coming fiscal year. Next slide. So now I just want to briefly go through again what the goals of the Prostate Cancer Research Program currently are as of FY20, just to help you understand what we're trying to achieve with the funds that we have. Our vision is nothing less than to conquer prostate cancer through our mission of funding research that will lead to the elimination of death from prostate cancer and enhance the well-being of service members, veterans, and all the men who are experiencing the impact of the disease. Within those broader vision and mission, on the next slide, we decided in 2018, along with other Cdmrp programs, to better define what types of goals that we have within that vision and mission and how we strategically plan to achieve those goals through the different aspects of the program. So in 2018, we did release a strategic plan, which summarizes the program's history, our importance to the military, the accomplishments that we've had to date and resources, as well as our strategic goals and how we plan to try and address those goals with our investment strategy. So those of you, again, that might be new to the program, I would encourage you to visit our website and read about our strategic plan if you're interested in learning more about the program's approach. Next slide. Within our strategic plan, the program also has 4 specific goals that we outline that we're trying to address within that broader vision and mission, which we call our overarching challenges. Those 4 overarching challenges are not necessarily all of the important issues that need to be addressed through research to help prostate cancer patients, but are the 4 areas that this program feels that we can best address with the funds that we have available, and again, understanding where the gaps are with other funding agencies. Our overarching challenges are specifically focused to help better define the biology of lethal prostate cancer, as well as develop treatments that will improve outcomes for men with lethal prostate cancer, because we feel that these patients are in most need of new advancements for better detection or treatment for a disease that will ultimately, unfortunately, be fatal. In addition to those 2 challenges, we also have a challenge that specifically looks at the issue of prostate cancer health disparity, by trying to reduce lethal prostate cancer in men of African descent, veterans, and other high-risk and underserved populations. Health disparity can come in many different forms, and we're interested in all aspects that might disproportionately affect some populations than others who might get prostate cancer. Lastly, we also feel that it is extremely important to help better understand and improve quality of life for survivors of prostate cancer. As many of you know, the journey does not end once you are diagnosed or receive treatment, and we want to make sure that those who are diagnosed with prostate cancer ultimately have the best quality of life possible. So ultimately, through those 4 overarching challenges, our investment strategy equally prioritizes innovative research as well as research with a high level of potential impact to try and address those challenges. We also support through our investment strategy a significant percentage of young investigators that we anticipate will become the future leaders in prostate cancer research and patient care, and also support a small amount of our budget towards supporting resources, including a biorepository network and our clinical trials consortium, which I'll spend a moment talking about in a couple slides. Next slide, please. To date, we've been able to support many different research advances, all ultimately trying to address those 4 overarching challenges, which you see in the blue bubbles on the left side. Towards each of those challenges, the program has an active pipeline of new results and advancements, some of which are in very early discovery stages, others of which are in more advanced preclinical stages, and some that have reached the clinic, or in some cases have even been FDA approved or commercialized and are benefiting patients to date. Next slide, please. So one of the interesting challenges for me when I'm addressing the Zero audience every year is to try and think about what can I say that's new, especially for those of you that perhaps are annual participants in the Zero Summit. And so I tried to come up with a few particular highlights that I wanted to briefly talk about that the Prostate Cancer Research Program has supported, and hopefully are some of the things that you have been tracking, again, as patients and advocates in the community. So one of the things that has been one of the biggest advancements for 2020 in the past 12 months was the fact that there was a new PSMA PET agent that was FDA approved, actually just in November of 2020. And the Prostate Cancer Research Program actually supported work from Dr. Marty Pomper, who's a physician at Johns Hopkins University. Many years ago, Dr. Pomper applied to the Prostate Cancer Research Program with an idea to develop a new small molecule agent for more sensitive functional imaging of prostate cancer, basing the idea of this small molecule agent based on a PSMA molecule that is present on prostate cancer cells. His work from this initial idea development award over a decade ago actually resulted in the development of the first practical human PSMA PET agent called 18-fluorine DCFBC. And while this particular agent was not necessarily the one that ultimately made it to FDA approval in November of 2020, his results in this very innovative, groundbreaking area laid the groundwork for the development of new other PSMA-targeted imaging agents in a field that didn't really exist very much at that time. And so the investment of the Prostate Cancer Research Program into his innovative ideas did lay the groundwork for what eventually helped get us the first PSMA PET agent that was FDA approved last fall. Next slide, please. As I mentioned in the previous slide, one of the resources that we support is also our Prostate Cancer Clinical Trials Consortium, which has been the reason that we have a number of different agents that have been FDA approved to date. In fact, this particular network of leading cancer centers across the United States has been responsible for helping 3 different agents get to FDA approval: abiraterone, enzalutamide, and apalutamide being the most recent one, which was approved in 2019. This particular network has been responsible for helping to rapidly advance the clinical testing of those 3 agents, as well as other promising therapeutics. And as a result, has accrued over 8,400 patients to more than 223 different clinical trials, all dedicated and focused on prostate cancer research. So again, hopefully get and find new agents that will help support men with prostate cancer. They have 11 other agents that have advanced to phase 3 testing to date, have also clinically validated the Epic Sciences ARV7 assay, which helps identify individuals who may not respond well to androgen signaling inhibitors, and have done a number of other group efforts that have changed the landscape of clinical trial design and patient care in the prostate cancer clinical field. I also wanted to just briefly mention the work that we supported for Dr. Wasim Abida. He actually was a physician scientist, a young physician scientist supported through our Physician Research Award, which looks to support and develop the careers of physicians in prostate cancer to become researchers in that area. And he proposed to the Prostate Cancer Research Program that he wanted to clinically evaluate different molecular subtypes of prostate cancer. He wanted to look specifically at any changes to the genome or the underlying code that might influence whether prostate cancer continues to progress to a more lethal form, specifically looking at DNA repair genes. And again, as many of you may have heard, these PARP inhibitors, which were recently FDA approved, the first one being rucaparib in May of 2020, Dr. Abita's work actually helped provide some additional clinical context and evidence, identifying subsets of prostate cancer with microsatellite instability, and found that those patients with specific mutations responded better to PARP inhibitors like rucaparib. And while his work did not necessarily result in, or did not do the specific clinical evaluation of rucaparib, the results of his work did help him identify some important factors that contributed to the design of the clinical trial that ultimately helped lead to the FDA approval of rucaparib in May of 2020. And the last slide, which I want to just briefly talk about, again, is another very innovative, groundbreaking, risk-taking type of study that, again, that's what the Pcrp is known for looking for those types of research studies. This work by Dr. Sam Denmead at Johns Hopkins University, he wanted to take a very novel approach to trying to treat men who were androgen-resistant, androgen-resistant prostate cancer with a new type of therapy by actually giving them high doses of testosterone, with the idea that this might resensitize the prostate cancer cells to being able to be treated again with enzalutamide, which is an androgen signaling inhibitor. Again, this was something that most people would never have thought would be something that would be a good idea, to give men with prostate cancer testosterone. But the results of this large-scale phase 2 clinical trial, his results showed that high doses of testosterone did not enhance or facilitate prostate cancer progression. And then actually giving this bipolar androgen therapy, cycling between high doses of testosterone and then enzalutamide, actually did resensitize patients to enzalutamide, giving them a better and longer response to this therapy. And not only, in addition to having a better response to the treatment, of course, giving the men testosterone also enhanced their quality of life. So again, while the future of this particular type of treatment is unclear, whether or not it would be FDA approved or how it would be incorporated into clinical practice, it's clear that this type of a risk will help benefit patients, hopefully, in the future, and is the type of research that the Pcrp likes to support. So lastly, I just want to mention that, again, if you'd like to keep up to date on some of the most novel advancements or the new research that the program is supporting, I encourage you to visit our website. This is a sampling of some of the highlights that have been posted in the past 12 months, looking at disparity, different types of prostate cancer treatments, again, understanding biology, things like that. And anytime, if you subscribe to our website, you will get updates on the different types of new research advancements that we're highlighting on our website. And so lastly, I'd like to close on the final slide, again, with just a reminder of the location of our website. I would encourage you to sign up for news and news releases that the program does like to highlight on the website. And again, there is information here about the role of consumers and how you can become involved with consumers as a consumer reviewer in the future. And so thank you again for this opportunity to tell you about the Pcrp, and I hope to see you in the future, perhaps as part of the Pcrp consumer review process.
Thank you, Dr. Cunningham. I think one of the most interesting things about the Pcrp is the role of patients in deciding how those research dollars are allocated. On our next panel, you'll hear from a few men who have participated in the Prostate Cancer Research Program as consumer reviewers. They'll talk about their experience, and I expect they'll tell you that you should get involved too.
Hi everyone, it's Jamie at Zero. The Prostate Cancer Research Program is an amazing source for funding for new treatments and diagnostic tools to help patients. We're fighting to increase that funding for this critical program to $120 million this year. And as Dr. Cunningham just mentioned, the Prostate Cancer Research Program has a unique consumer review component to its grant-making process, meaning that it empowers prostate cancer patients and survivors to actively participate in the review process to determine which medical institutions get funding for prostate cancer-related projects. And I'm absolutely thrilled to be joined today by Zero champions, Tony Minter, David Piper, and Harvey Scherzer. Gentlemen, welcome. Good to see you. Thanks for joining us.
Good to see you also.
Pleasure.
To jump in, all of you have taken the opportunity to participate as a consumer reviewer in this program. And I just want to make 2 points before we dive in, because I have some questions for you. One is, it's critical to have more patients get involved in this program. And two is to be able to make an impact, such a great impact on the progress of prostate cancer research. It can really be an incredible healing process while battling the disease. So with that, David, I'll start with you. Why did you decide to participate as a reviewer?
Well, it was 2 years ago when I had my first chance to participate. And I once again, my diagnosis was something that I felt if I could get something positive out of my cancer diagnosis, my prostate cancer diagnosis, and help others, that would be a way for me to kind of pay it forward. And I felt like this was a great opportunity to do that. I thought I had a unique perspective, and as a patient and a survivor and a son of a survivor, I thought I had the ability to maybe open up the eyes of the scientists into what we really need and what we're looking for too.
Thanks, David. Now, how about you, Tony? What made you decide to be a participant within the PCRP Consumer Review panel?
Well, I've been a participant for the last 5 years, 2 years as a mentor. I learned about the program during the summit, a Zero Summit. And the more I learned about the program, the more I felt like this would be a great opportunity to see what's going on in the world of research, and also to get an idea of what it was like being viewed from a patient's perspective versus the doctor's perspective. And the first year I did it, I was hooked, because the opinions of the consumer was taken seriously. And we mattered as much about the program as the physicians and scientists did.
That's terrific. At 5 years, Tony, you might have the record of participating on the panel the most times. That's wonderful. Now, Harvey, you've been on the Consumer Review panel a couple of times now, right? Tell me about what made you decide to participate.
Well, Jamie, for the reasons that both Tony and David said very eloquently, and I will confess also that I was just plain curious, since I have worked with the government in different capacities for my entire career. I was frankly curious as to how the government goes about making decisions to award grants in an area of prostate cancer research that's so important to me. I learned a lot from it. I learned about the process, but also, as I believe it was Tony said, I learned that the consumer reviewers are indeed taken very seriously by the doctors and scientists that participate. And that was an unexpected and very wonderful result.
Yeah, absolutely. And the workload itself that goes into being part of the panel is really serious business too. So let me shift back to you, Tony. What kind of commitment was that like, or how much time and energy is involved in being part of the PCRP Consumer Review panel?
You know, it's interesting. This year we did a virtual review, and I found that it was different than actually being there in the building doing the review. The time commitment is a little bit greater, I felt, when we did the virtual, because it's, it requires a lot of research, understanding words, and I would say probably a good estimate would probably be 4 hours, not consecutive, but 4 hours total per application. And you usually end up anywhere with 10 to 15 applications.
Gotcha. Now, when you first went in, did you think that, oh, I don't know, I mean, maybe you do, but if I went in, I would say, well, I don't know science. I don't know how to read this proposal. I don't have the same credentials as, some of these medical professionals that are reading through this. Take me through that. What's the gap there of, or how do you get over that?
That's really crucial to understand that you don't have to be a scientist. You don't have to be a physician, because what you're doing is you're looking at these applications from the perspective of a consumer as a survivor. And there are some words that you have to look up to understand exactly what they mean. And it can be intimidating. It can be very intimidating to look at 100 pages and think, now I have to evaluate this. I have to look at this and see what kind of score I'm going to give to a bunch of medical jargon that I really don't understand. And so there's a portion of the application called a lay abstract, which is supposed to be written in common everyday language that the general population can understand. So when you go through the training with your mentor and they help you to understand that you don't have to look at all 100 pages, just this portion here, and make your ratings based on that, it's not as intimidating. Now, you can go deeper and read more, which I like to do because it gives me a better understanding of exactly what this proposal is all about. But when you start off, it's good to get with your mentor and have them to walk you through it, and that'll help you to be more comfortable with the review process.
Thanks, Tony. Harvey, what would you say? What from your perspective, what was the commitment like?
Again, I agree with Tony. It's the commitment. If you add up the hours that Tony indicated, it's substantial. It's a non-trivial commitment of time and energy. It was harder than I expected because I'm not a scientist, and the language of some of the proposals, it really tells you that if you were at an organization that is seeking a grant, how the grant is written does impact whether it's successfully conveys not just to a consumer reviewer, but even to the other doctors and scientists, what the individual seeking the grant is trying to say. Some are written better than others. Mm-hmm. But it can be, as Tony said, intimidating and daunting. The most daunting thing I found was that in the live sessions, which were the best before pre-COVID, what I found the most daunting was in the sessions I was in, the consumer reviewer was asked to head up the discussion of several of the grant proposals. They had one person give a summary of the grant for each of, I think it was 20 different grants. That I found particularly intimidating, being a non-scientist, to get up there and try to explain to the scientists and doctors what this grant applicant is proposing. That made me nervous, frankly, but it worked out okay. And as Tony said, what you're really supposed to focus on as a consumer reviewer is the impact, what impact it would have on patients. And if one focuses on that, it becomes less intimidating. And the impact is very important to convey that to the doctors and scientists that are there. Many of the proposals seem quite abstract, and getting into sensible language that tells a prospective patient or survivor what this is going to do, how it's going to advance the ball, is a very good thing. So I tried to follow that rule, that advice I was given, to look at the impact the most.
That's great. Thank you, Harvey. David, what would you add? What kind of time commitment was it for you from your perspective?
Well, I would agree with both Harvey and Tony. Each grant that you read and studied some of them were easier to read, some were more difficult. So, at times you could spend an hour on one to go through, and some of them took 3 or 4 hours because you had to kind of research what was going on. There was the lay abstract, which was really good. And then I like to try to go and read the actual abstract because it got a little bit more detailed. And I felt that sometimes they dummied it down too much in the lay abstract for us. And I think they left out some of the things. So it was good for me to kind of go into the other parts of it. One of the things I remember from the summit with the Pcrp was that it was supposed to be a high risk, high reward. And I think that was the best part about our commitment during the sessions, whether it was the Zoom session or the live sessions, is to explain to some of the scientists that some of these abstracts were really great ideas, but it seemed like it was going to take too long to get the process done. And I kept on trying to remind them, this is supposed to be high risk, high reward. We want to get results. And so I felt sometimes I was trying to look at the things that were going to maybe correct the problems faster than the scientists were looking at. So that was the hard thing, to kind of convey that information to them.
Thanks, David. It sounds like all of you really learned a lot from the process and being involved in this. And Harvey, tell me about, what did you learn through this process, and were there any, in your time serving on the panel, is there a proposal that sort of stuck out to you that you were like, wow, I really can't wait to see how this turns out, because this is sort of a fantastic idea that's really exciting?
It's an interesting question, Jamie, because I sort of gave myself a test in advance. After going through all the research proposals, I was testing myself to see if my score, which they put up on a screen at the end so you can tell how each person was voting, I wanted to see if my thoughts were consistent with the doctors and scientists, or had I totally missed the boat. And I found in a few cases, and it gave me more confidence, that I had picked out those that really were head and shoulders above the others. And that is interesting too. It's interesting when you look at 15 of them that you will find 2 or 3 that, to use your question in writing, that are actually cool and look like they're going to advance the ball and help the future patients. Some do stand out. And I learned that. I learned a lot about grants and grant writing from it, which is sort of separate from prostate cancer itself, but I learned a lot about how one should do a grant. Not that I'm doing any grant proposals, but I just learned how they should be done.
That's great. And what about you, David? What did you learn from the process? And was anything like I asked Harvey, were there any proposals that really stood out to you that you're in the mindset of, wow, I can't wait to see how this turns out because I'm excited about this idea?
Yeah, there were a number of proposals. A lot of, we can't get into the specifics, of course, but there were some that dealt with diagnostics, and that to me was very promising. It seemed like those are going to be very important to get at that. And then some of the treatments that they had developed. The part that I think that made me the happiest about this whole process is there's a lot of care and a lot of careful planning and thinking going into this grant, the grant rewards. It's not like a person can apply and they get this grant. I mean, they are scrutinized, and the scientific reviewers weren't holding or pulling punches. If they thought that a grant was poorly written, they would get all over it. So I felt like the monies that were going into these grants were well spent. I mean, it was researched, and I felt very good about that kind of government spending, I guess. That was one thing I got out of it.
Thanks, David. Now, Tony, with your 5 years of experience on being part of the Pcrp Consumer Review Panel, I would say that you had the opportunity to have learned quite a lot in depth. What could you add in addition to what Harvey and David have said? And has there ever been a proposal that's stood out to you that's been exciting?
Yeah, sure. One of the things that I like about the Prostate Cancer Research Program is they have several different panels, and these panels specifically tell them what the requirements are for the grant writers to target. And those grants that hit that target are the ones that are most impactful and address what they're asking for. And there have been several that I personally found to be very rewarding. And those are the ones that dealt with the advanced stage prostate cancer and things that would help a person have a better quality of life. There were some that really hit the nail on the head when it came to quality of life. And there were also some that dealt with treatment, different drug treatments that I thought were extremely well written and had a great chance of being successful. And so that's what we do. We look at it to see what is the likelihood of success. If everything goes like the grant writer says, how likely is it to be successful? Those are the ones that have the most impact, those that we deem most successful, are going to be most successful. But it's a really really well ran process for getting from point A to point B to point Z.
Great, and I've mentioned a couple of times now of doing it every year for the last 5 years, right? So would you do it again? Would you come back?
Absolutely, I would do it every year that I'm able to.
Now, why? Why is that, Tony?
Because I learn something every year, and then I look to see if I can feel or visualize the impact later on for those that were approved and implemented, if I could see it. And from the first year I did it up until now, I noticed that there were some that are actually making a difference and making an impact in the lives of prostate cancer survivors. And as an advocate, as an educator, it gives me a foundation for speaking with men about prostate cancer and say, hey, look, there's hope. There's a lot of research going on, and there's hope. And if I can give them hope to just hang on in there and trust the process, then it's worth it.
Well said. Well said. Thank you, Tony. How about you, David? I know that we haven't touched on this, but you've been on the panel multiple times as well, right?
Yeah, this is my second year of being on the panel. I will do it again if they want me back. And that's what I've said all along. I really enjoyed my time doing the research, and learning about these different studies was just amazing. The other thing that really, I guess, warmed my heart more than anything is the other reviewers, the scientific reviewers on the panels, whether they're MDs or research scientists. They're passionate, as passionate as I am about trying to find a cure for prostate cancer. And that was very heartwarming to see their aggressive passion towards finding treatment modalities or diagnostic tools or whatever the case may be. They were hoping to take these research grants and things to push them forward and push the envelope into getting rid of this awful disease. So that to me was thrilling to be part of that.
Thanks, David. What about you, Harvey? Would you come back for year 3?
I would. I was unable to do it this year because of scheduling conflicts, so I had to decline. I agree to everything with what Tony and David both said very well. The one thing I would also add is during the in-person pre-COVID sessions, it is very it's heartwarming and it's reassuring and just altogether great to spend the time with other men who have had to deal with this disease, this horrible disease, and with the scientists and doctors who are working on it. You just come away feeling reassured that progress is being made and will continue to be made, and that there's a passion, as I think David just said, and commitment to doing so. That you lose, of course, in a Zoom environment, but in person, where you're just there and you're talking during breaks and that sort of thing, it's just a great experience. Very much worth doing.
Yeah, I imagine that going through a prostate cancer journey is one of the most difficult things in your life, but to be able to participate in this process really gives you, as you said, Harvey, that sort of psychological and emotional sort of comfort that you're not alone, that you've got other patients and family members and doctors and scientists who are sort of all got your back and all standing shoulder to shoulder with you.
Yes.
Now, tell me, gentlemen, when you applied to be on the Pcrp panel, what was that process like? Was it difficult to do? Any one of you want to volunteer to take me through the steps on what you did?
I'll start. It happened that during one of the summits when I was there, I forget off the top of my head, the woman who was out there, she had a table and there was a sign-up sheet, and I signed up, and then there were emails that followed, and we kind of worked through the process. I don't remember the exact logistics of the whole process, but it was really easy and straightforward. It was just a matter of looking to see if there was a spot that fit me and fit my abilities, I guess, and if the time frame worked, and everything seemed to fall into place for me. So I will agree that in person was so much nicer than the Zoom, but we made it work this year, and if that's the way it's going to be next year, so be it. It's a good program, but I felt it was easy.
Thank you, David. Tony, would you add anything that you can think of about the process of applying?
Yeah, I think David was spot on. The only thing I would like to add is that there is a sponsoring organization for you. Like Zero could be the sponsor for opening that doorway for you to get in. And your sponsoring organization really is a big help in you being selected for it. There's no real application for it. They're looking for the desire to serve and that you have the time to commit yourself to the process. And I would say anybody who wants to do it, please do it. Don't be afraid, because they will assign you a mentor. And those mentors are extremely important into helping you learn the process and to walk with you on that journey. I've had the opportunity to meet the guys that I was mentoring because we were on the same panel, and it was amazing. We've got these lifelong relationships now. So yeah, it's a very rewarding thing to do.
Great that you've got those lifelong friendships now. And if somebody applies and gets in, they can have Tony be their mentor, right?
Yeah.
Harvey, would you add anything to add about the process of applying?
I think Tony and David covered it. I believe that Zero was the sponsoring organization for me, although I'm active at Hopkins as well. That's very important. From my recollection, I was interviewed by phone by the woman who is or was in charge at the time. And it was a very straightforward interview and process. Very, very easy.
That's right. All well said, gentlemen. Thank you so much. And yes, we are a sponsoring organization. If you're attending the summit, if you're one of our advocates, if you're one of our Zero champions, reach out to us, reach out to me, let me know. I'm happy to help make sure that you get sponsored so we can get you as part of the panel. You can also, on your app, go in and see the Prostate Cancer Research Program booth in the health fair portion of the app. That way you can learn more about the research that's getting done at the PCRP, and you can learn how to become a consumer reviewer, just like Tony, Harvey, and David. And as I said, we'll be able to help you out and get you involved. And you can express your interest right there in the app, or you can reach out to us by going to zerocancer.org. Gentlemen, thank you so much for making time today to talk about the Prostate Cancer Research Program and how critical it is to be able to end prostate cancer and stop the pain and suffering endured by men and families who are undergoing this journey. I really appreciate you joining me today.
My pleasure. Thank you.
It's been my pleasure. You're more than welcome. Thank you, Jamie.
Thanks, David.
And I want to thank you for allowing us to come and share with this very important program and be a part of hopefully recruiting some more advocates to serve.
Thanks, Tony. Here's to 5 more years you've been on the PCRP, or until we end prostate cancer and we don't need it anymore.
Yes.
Thank you.
I'm Arkansas Senator John Bozeman. I'm pleased you've been able to find a new way to continue your advocacy and be a voice for prostate cancer patients, survivors, caregivers, and loved ones. I've seen firsthand the pain and suffering this disease causes. We lost my dad and my father-in-law, both of who courageously fought against prostate cancer. I don't want other patients or families to have to experience that battle. Unfortunately, 1 in 9 American men will be diagnosed with prostate cancer in their lifetime. It's the leading cause of cancer death for men in our country, but we can work together to change these statistics. Congress has funded critical research so we can develop treatments and discover a cure for prostate cancer. We've increased funding for research at the National Institutes of Health by more than $11 billion since 2016, and for more than 20 years, the Prostate Cancer Research Program at the Department of Defense has worked to bring hope that we can end this disease. Investing in these programs is essential to our fight against prostate cancer. That's why it's so important for lawmakers to hear from individuals like you who have been touched by this disease. It goes a long way to helping senators and House members make informed decisions about funding levels for research. We know early screening and diagnosis can give men a greater chance of survival. With the help of Zero the End of Prostate Cancer and other advocacy organizations, we can raise awareness and encourage men to make decisions that improve early detection and outcomes for those who are diagnosed with the disease. Thank you so much for your commitment to champion advances to and life-saving developments in the fight against prostate cancer. Through your work, we can give men and their families hope for a brighter future.
Thank you for hanging in there. We're in the home stretch for our advocacy programming, but we still have some exciting and important information to share. First, I'd like to talk to y'all a little bit about our Zero Cost to Prostate Cancer Screening Initiative, our primary legislative effort in the states. At this point in the summit, I think that everyone has seen these numbers. Prostate cancer is growing, and the impact of delayed care during the pandemic is making itself known. In 2021, the American Cancer Society predicts that a man will be diagnosed with prostate cancer once every 2 minutes, and a patient will die of prostate cancer every 15 minutes. So why is screening so important? It isn't just so that we can contribute to those numbers. Prostate cancer screening is important because screening saves lives. I've said it before and I'll say it again. Screening saves lives. The 5-year survival rate for a patient diagnosed with local prostate cancer is almost 100%. For patients with advanced disease, it drops to 30%. Prostate cancer is a very survivable disease if you catch it early. Our primary tool for prostate cancer screening is the prostate-specific antigen test. This blood test measures the amount of PSA produced by the prostate in the bloodstream. Elevated PSA levels by themselves don't necessarily indicate prostate cancer. There are other possible reasons, but they're certainly the leading indicator for many men diagnosed with prostate cancer who generally don't have any other symptoms early in the disease course. So what's the controversy, right? The United States Preventive Services Task Force, the USPSTF, grades preventive services like screenings on a scale from A to D. Services with a D rating are not recommended. Services with an A or B rating are recommended, and services with a C rating are recommended on a case-by-case basis. The USPSTF rates PSA testing with a C. It's an upgrade from the D rating it used to receive, but not a clear thumbs up. So what? The USPSTF ratings matter because services with an A or B rating are covered by insurance plans without cost sharing. That means screening for breast cancer, cervical cancer, and colorectal cancer, among other preventive services, are provided to insured patients without paying anything out of pocket. Essentially, the USPSTF ratings are used to say these services are so important to keeping patients healthy that we don't want costs to be a barrier for patients. We know that PSA testing is an important screening tool for diagnosing prostate cancer. It may not be perfect, but it is hands down the best tool we have to catch prostate cancer in the early stages when the chance of survival is almost 100%. So our goal at Zero is to make prostate cancer screening free and accessible for all men. You've already heard about our federal legislative effort, the PSA for Him Act, and I know everyone is excited to advocate for it next week. But federal legislation can take time, and sometimes the fastest way to make change is to go directly to the states. And that's where we have our Zero Cost to Prostate Cancer Screening initiative. We're working to turn this map blue by passing laws that eliminate cost sharing for prostate cancer screening. We've had some early successes. New York took the lead, passing a law to eliminate cost sharing for prostate cancer screening for all men over the age of 50 and for high-risk men over the age of 40. We were thrilled to pass a similar law in Maryland last year. In fact, it just took effect on January 1. In Maryland, all men ages 40 to 75 now have access to prostate cancer screening without cost sharing through their insurance. You'll notice, of course, that these laws aren't identical. That's an upside and a downside of state legislation. Each bill is developed on the same baseline, but the details are unique to the states, to their population, to their politics, and to their policymakers. In 2021, we're looking ahead to our next targets. That's California and Illinois. In California, we're lucky to have a dedicated champion in Ryan Pessa, who is helping us, and I believe Ryan is also watching this today. He's helping us to move this bill along, get language drafted, and hopefully get it introduced and passed this year. We're also working with partners like the American Urological Association, the California Urological Association, and the American Cancer Society Action Network, among others. We're just getting started in Illinois, but again, we'll rely on partnerships and champions to get the job done. And the results will be a unique solution that removes one of the barriers that prevents men from getting an early diagnosis of prostate cancer and hopefully an eventual clean bill of health. Hopefully, you're now thinking to yourself, how can I get involved? Obviously, I am personally thrilled that you're here today working to make a difference at the federal level. But I would also welcome your efforts in your own backyard. You can visit zerocancer.org/advocacy to sign up for action alerts when we have opportunities in your state. And you can always email me at ali@zerocancer.org. That's ali@zerocancer.org to learn more about getting involved. You've already heard about the Zero Cost to Prostate Cancer Policy Screening Initiative, but it isn't the only opportunity for prostate cancer policy at the state level. I'd like to welcome Molly Williams, who works in global policy and public affairs at Pfizer. She's going to talk a little bit about advocacy at the state level.
Well, thank you, Ali. I really appreciate it. And thank you to Zero Cancer for providing time for me to talk to you about something that is very near and dear to me, and it's effective advocacy. As Ali said, I'm the the Director of Alliance Development for Pfizer. And I'm going to just go to the next slide. So what is an advocate? An advocate is someone who publicly supports or recommends a particular cause or policy. There's a lot of synonyms that I think are fantastic: a champion, a supporter, a promoter, a proponent, and we're all advocates. We all are out there searching and looking for ways to improve, if it's access to care, access to treatment, even just, access to making sure you get the right information. Being an advocate is someone who is a spokesperson, someone who speaks for others, someone who speaks for themselves. It is a powerful tool that we have to make change. What is a policymaker? Today, we're really going to focus on those government policymakers, but a policymaker is someone who creates ideas and plans, especially those carried out by a business or a government. And examples of policymakers may be your local mayor, the school board, your local state legislators, your Congress people, the President of the United States. All of these are policymakers. Policy refers to the plans that a government follows. Since we're talking about government today, I'm going to focus on that. What's lobbying? So lobbying sometimes is viewed a little negatively. I think it's that, there's been a lot of movies, a lot of different ideas about what a lobbyist is. But lobbying really is just looking to influence or seeking to influence a politician or public official on an issue. So if you are an advocate, you are going to be lobbying your policymakers to ask for changes or ask for new laws that either will provide better access to care, that will provide you with protection. You are looking to persuade them to do something to help you. As an advocate, you can change the conversation by communicating with your with your elected officials, those who represent you both at the local, the state, and the national level. Your elected officials rely on people like you to make educated decisions about policy. It's their job to represent the needs of their constituents. You are their constituent. That is why they were elected by you. So how can real people make a difference? In February of 2020, I was in Washington, D.C. at this meeting, and I was presenting, and this is one of the slides that I had included. And these were the issues that I wanted to discuss last year. We were talking about healthcare, health insurance, pharmaceutical costs, treatment. And then in March of 2020, everything shifted to COVID-19. And while it has been an incredibly trying year for everyone across the world living through a pandemic, there have been some opportunities and different changes that have made what we do and being advocates a little bit easier. However, in addition to COVID-19 kind of overshadowing everything, there are still policy issues out there that we need to talk about. So some of the issues that I think you're going to learn about during this meeting and this week, I think I've highlighted here. Zero Cancer is doing a great job in advocating for some changes that I think are really important. One, PSA testing coverage, insurance coverage for PSA testing, increasing access to prostate cancer care for Black men, continued funding for the Prostate Cancer Research Program, and then some other state initiatives that are of interest, I think, to this community have to do with step therapy reform. This is an insurance practice. Also looking at out-of-pocket cost reform. There are many different proposals, both at the state and federal level, to try to help patients at the pharmacy to afford their medications. These are just a few of the policy issues that might be of interest. So, as I said, COVID has provided some unique opportunities as far as communicating with policymakers. And I wanted to highlight a few today. Some of the changes that we've seen where you used to have to go to your state house, go to your capital for a lobby day where you were going to go and meet with your legislators. Obviously, a lot of capitals are closed due to COVID. They're not allowing the public in. So what's changed is that everything has gone virtual, very much like this meeting. And it's actually become much more convenient, both for the advocate as well as for those legislators. So we are now seeing the advent of virtual lobby days or virtual visits with legislators. What I have pictured here is a hearing from New York where all of the legislators who are part of the health committee were participating on a Zoom call, and this was made public. And so we could listen in, but in addition, in some other instances, you're allowed to testify through Zoom. And I think it's helping because for a lot of people, it's really difficult to get to their state capitals. They don't live close. It takes a lot to travel there. You have to leave work. It's just not convenient. So if you could take an hour out of your day and be able to participate virtually, you're going to get a lot more participation. The most interesting to me has been the virtual press conference. These are can be very complicated, orchestrated events where you need to have a legislator, you need to have stakeholders, so advocates, you need to have, in some cases, a lot of patient advocacy groups bring in doctors to advocate for a specific bill, let's say legislation. And to bring all those people together for 1 hour in a Capitol building, it could be very complicated. And then in addition, you also had to have the media there because they're clearly the audience. With the virtual press conference, now we really can make that happen in a much more convenient way for all participants, including the media. So these are just some of the successful adaptations we've made because of the living in a pandemic. So what can you do? Start small. I'm providing a lot of information here, and it's designed to be that you can start from the simple phone call to your local legislator, emailing your legislator. If you know that they're supporting legislation or you're opposed to something they're doing, you can send them an email and just simply tell them what you want. You can also, if you get a little bit more sophisticated, you could tag your legislators on social media, or you can attend an advocacy day, which can be a lot easier now that they're virtual. Be strategic. What's your message? Who do you want to tell? In addition, also do what you can when you can. Some days may be better than others. This is designed to have flexibility. This is not designed to, you're not required to do it all. You need to really pick and choose what's going to work for you. I think one of the most important things to emphasize is that you are the expert. A lot of times I think people are a little intimidated by the idea of speaking to a legislator or speaking to the staff person, but it's your story. It's your experience. They need to understand how something is affecting you so that they can help you to make that change. And if you want to tell your story, you can obviously call your legislator and tell them the story, but there are other opportunities. You can, work with an organization like Zero. You can tell your story to the media. There are many different ways to broadcast and get that messaging out there. Lastly, I have here to get involved. And as I said, Zero Cancer advocacy organizations like that, like Zero, are excellent sources and resources for providing training for advocacy, getting you more information about the different issues, helping you to understand that there are ways that you can change your current circumstances, and also kind of understanding complex issues that you may not even realize you're experiencing, and that there are finding ways to help make change. And you can also join advocacy groups both at the state and local level. So there's a lot of different resources out there that can help you to become a stronger advocate. So lastly, what do you need to do? You need to let your elected officials know what you want. They make daily decisions about different policy changes that are going to be made at the local, state, and federal level. They are the ones that have the ability to change a law, to reform a policy, or to enact a new law that their constituents, or you and me, may support or oppose. But they can't read our minds. And some may think they can, but really it's our responsibility to let them know what we want them to do. And while we may not always agree, and they may not agree with our positions, if we don't ask, they'll never know what we want. So in closing, first of all, I want to thank you for allowing me the time to speak with you today. I hope you find this useful. And I hope it encourages you to tell your stories, because you can make a difference. And again, thank you to Zero Cancer for allowing me to have the time today.
Thank you so much, Molly. Advocacy isn't just something we do once a year in Washington, D.C. And if you think this week is impactful, just wait till you see what you can do in your states. And please consider this my personal invitation to each and every one of you to get involved with the Zero Cost to Prostate Cancer Screening Initiative and in the other state opportunities that will surely arise. I know we'll be teaming up with Molly and other partners in your communities over the course of the next year. And thank you, everyone. It's been a long week to sit in front of a computer screen, but I hope you learned a lot. I hope you remember there were 5 treatments for advanced disease that have been supported by the Prostate Cancer Research Program. And I don't know about you, but listening to Tony, David, and Harvey talk about their experiences as consumer reviewers really, really made me want to sign up to do that for the Prostate Cancer Research Program too. And you can get more information about serving in that role in the virtual health fair. Before we go, let's recap our asks for your Hill meetings next week. First, we're asking for $120 million for the Prostate Cancer Research Program, 120 with a big M next to it. We're asking for $16.2 million in CDC funding, and we're asking for report language that focuses on high-risk men. We're asking for co-sponsorship of the Prostate-Specific Antigen Screening for High-Risk Insured Men Act. That's the PSA for HIM Act. And we're asking for co-sponsorship of Representative Dunn's Veterans Prostate Cancer Treatment and Research Act when it's introduced in the coming weeks. Those are our asks. You can always look at them again at zerocancer.org/advocacy and in the materials we've sent to you. You received emails yesterday with the links to your meeting portal. Check your email this weekend. You'll receive final schedules with any changes or new meetings that have been added, review your talking points, coordinate with the other folks on your team so you're ready to go into those meetings and deliver your message smoothly. Hopefully yesterday's practice took a little bit of the fear and excitement out of it. Not the excitement, just the fear. And have fun. The virtual environment is different, but it's still your opportunity to take an active role in our democracy. And even as someone who does this for a job, I'll say it's still a thrill to walk around the marble halls of Congress, even after years of doing it. This year's not quite the same, and we're definitely looking forward to getting back together in DC next year. But COVID didn't stop time for cancer patients, and our priorities are as important as they ever were. So remember, all of our presentations this week were recorded. You can go back and rewatch anything you need to in the app, and you can always reach Susan and me with any questions. Email me at ally@zerocancer.org. Thank you, and good luck next week.